Lyme disease testing is extremely flawed, which compels us to scrutinize testing more closely, and this can become confusing. You might often hear people ask, well, what was your Lyme titer? A Lyme titer test, also known as a Lyme disease antibody test, or Lyme serology, is a blood test used to detect antibodies produced by the immune system in response to the bacteria Borrelia burgdorferi, which causes Lyme disease. It checks how our body's immune system responds to the bad bacteria causing Lyme disease. The trouble with this test is it's measuring an immune response, and Lyme disease is notorious for suppressing immune response. This obviously leads to issues in diagnostics. Let's talk more about how a Lyme titer test works, so you can more deeply understand what parts of the test are helpful and which are lacking. How Lyme titer tests work. Lyme titer tests work by detecting the presence of antibodies produced by the immune system in response to the bacteria for Lyme disease. When a person is exposed to the bacteria through a tick bite or other means, the immune system initiates a defense mechanism by generating antibodies. The two primary types of antibodies detected in Lyme titer tests are immunoglobulin M, IgM, and immunoglobulin G, IgG. IgM antibodies are typically the first to appear after infection, while IgG antibodies follow and can persist for a longer time, often indicating past or ongoing infection. The initial screening test for Lyme disease is usually an enzyme immunoassay EIA or enzyme-linked immunosorbent assay ELISA. If the EIA and/or ELISA test result is positive or borderline, a confirmatory test called the Western blot is usually conducted. The Western blot is supposed to identify specific antibodies against various components of the Borrelia bacterium, providing more definitive information. However, it is important to note that these tests frequently are accurate. They can take several weeks for the immune system to produce detectable levels of antibodies, leading to potential false negative results if tested too soon after exposure. What are the types of Lyme titer tests available? There are several types of Lyme titer tests used for the diagnosis of Lyme disease. These tests can be categorized into two main groups: direct detection tests and indirect detection tests. Direct detection tests aim to detect the presence of the Lyme bacteria Borrelia burgdorferi, or its genetic material, while indirect detection tests focus on detecting antibodies produced by the immune system in response to the presence of the bacteria. The direct detection tests are categorized as follows. A. Culture. This test involves attempting to grow the Lyme bacteria in a laboratory setting. However, culturing Lyme disease bacteria is challenging because the bacteria do not remain in the blood or spinal fluid for an extended period. As a result, this test is not commonly used for diagnosing Lyme disease. B. PCR. That is polymerase chain reaction. PCR is a molecular biology technique that looks for the genetic material, DNA, of Borrelia burgdorferi in the blood or spinal fluid. PCR tests are not very sensitive for Lyme disease because the genetic material of the bacteria may not remain detectable for long in these body fluids after the initial infection. C. Antigen detection. This test aims to detect pieces of the protein of Borrelia burgdorferi. It is usually performed on urine samples, and the assumption is that the presence of these protein fragments indicates recent infection. However, antigen detection tests are still considered relatively experimental and not widely used for routine diagnosis. On the other hand, the indirect detection tests are A. Antibody-based tests, ELISA, IFA, Western blot, immunoblot. These tests detect antibodies produced by the immune system in response to the presence of Borrelia burgdorferi. They are the most commonly ordered tests for Lyme disease. The indirect fluorescent antibody, IFA test, was the first one developed, but is rarely used today due to its subjectivity. The enzyme-linked immunosorbent assay ELISA is more quantitative and automated. The Western blot, or immunoblot, often used as a confirmatory test, identifies specific antibodies targeting different components of the Lyme bacteria. Here are some key points about these antibody-based tests. A positive result on these tests indicates that a person has likely been infected with the Lyme bacteria in the past or recently. It does not necessarily mean that active infection is present. A negative result early in infection is not meaningful, as it takes time for the immune system to produce detectable antibodies. Cross-reactivity with other microbes can lead to false positive results. These tests have poor sensitivity in early Lyme disease and may also lack sensitivity in some later stages of the disease. The CDC recommends a two-tiered testing strategy involving an initial ELISA or IFA test, followed by a Western blot if the initial test is equivocal or positive. Interpretation of Western blot results depends on the presence of specific bands. B. Recombinant or synthetic antigens. Advancement in diagnostic testing have led to the incorporation of recombinant or synthetic antigens in some tests, such as the C6 peptide ELISA and VLSE ELISA. These synthetic antigens are considered more precise markers of the Borrelia spirochete and may improve the sensitivity and specificity of the tests. That said, let's look at how Lyme Titer test results are interpreted. Interpreting Lyme Titer test results requires careful consideration of various factors, including the patient's clinical symptoms, medical history, and the specific test used. Lyme Titer tests are commonly used to detect antibodies against Borrelia burgdorferi, the bacterium that causes Lyme disease. A positive result indicates that the person has likely been exposed to the bacteria at some point, but it does not necessarily confirm an active infection. It is crucial to correlate test results with the patient's symptoms and possible exposure to ticks in endemic areas. For more conclusive results, a two-tiered testing approach involving an initial ELISA or IFA test and a confirmatory Western blot is often recommended. Additionally, advancements in recombinant or synthetic antigen-based tests may improve test accuracy. Overall, clinical judgment and an understanding of the limitations of these tests are essential for accurate interpretation. Now you might ask, what are false positives and false negatives in Lyme Titer testing? False positives and false negatives are two common issues encountered in Lyme Titer testing. A false positive occurs when the test indicates Lyme disease when there is no actual infection. This can happen due to cross-reactivity with antibodies produced against other microbes, leading to a misinterpretation of test results. False positives may also occur if the patient has been previously infected and still has detectable antibodies, even if the infection has been successfully treated. On the other hand, a false negative result occurs when the test fails to detect Lyme disease despite the patient being infected. False negatives can happen in the early stages of infection when the immune response has not yet produced detectable levels of antibodies. Sensitivity issues in the tests may also contribute to false negatives, particularly in later stages of the disease. To minimize false results, using a combination of tests, clinical evaluation, and patient history is critical when Lyme disease is strongly suspected despite negative test results. Repeat testing or alternative diagnostic approaches may be necessary for accurate diagnosis and appropriate treatment. Healthcare providers should always consider both false positive and false negative possibilities when interpreting Lyme Titer test results. Now let's also look at the factors affecting the accuracy of Lyme Titer tests. The accuracy of Lyme Titer tests can be influenced by various factors, which can lead to both false positive and false negative results. Understanding these factors is essential for healthcare providers to interpret test results accurately and make informed clinical decisions. Here are some key factors affecting the accuracy of Lyme Titer tests. 1. Timing of testing. Lyme Titer tests may not detect antibodies during the early stage of infection because it takes time for the immune system to produce a detectable antibody response. This can lead to false negative results if the test is performed too soon after exposure. 2. Stage of infection. The sensitivity of Lyme Titer tests can vary depending on the stage of the disease. In early Lyme disease, the antibody response may not be fully developed, leading to lower sensitivity and potential false negatives. Conversely, in later stages of the disease, antibody levels may decline, resulting in reduced sensitivity. 3. Type of test used. Different types of Lyme Titer tests, such as ELISA, IFA, and Western blot, have varying sensitivities and specificities. Using a combination of tests can improve overall accuracy. 4. Antigen variability. The antigens used in Lyme Titer tests may vary between different test kits and laboratories, which can impact test performance and consistency. 5. Cross-reactivity. Lyme Titer tests can cross-react with antibodies produced in response to other infections, leading to false positive results. This is particularly relevant in regions where other tick-borne diseases are prevalent. 6. Prior Lyme disease history. Patients who have been previously infected with Lyme disease and successfully treated may still have detectable antibodies, resulting in false positive results in subsequent tests. 7. Geographic variation. Lyme disease is more common in certain regions, and the prevalence of specific Borrelia strains can vary geographically. Test performance may differ in different endemic areas. 8. Immunocompromised patients. Individuals with compromised immune systems may not mount a robust antibody response, leading to false negatives or reduced sensitivity of the tests. 9. Testing methodology. Variations in laboratory procedures, sample handling, and equipment calibration can affect test accuracy. Reliable and standardized testing protocols are crucial for consistent results. 10. Interpretation of Western blot. Western blot results are often subjective, and there can be variability in how different laboratories interpret the presence of specific bands, leading to potential discrepancies in test outcomes. 11. Co-infections. Patients with Lyme disease may have concurrent infections with other pathogens, which can influence the immune response and affect test results. To improve the accuracy of Lyme Titer testing, healthcare providers should carefully consider these factors and correlate test results with the patient's clinical presentation, medical history, and possible exposure to ticks in endemic areas. In cases of diagnostic uncertainty, additional testing or clinical evaluation may be necessary to make a definitive diagnosis and provide appropriate treatment. That said, let's shed a spotlight on Lyme Titer tests versus clinical diagnosis. Lyme Titer tests and clinical diagnosis play complementary roles in the evaluation of Lyme disease. Lyme Titer tests, such as ELISA and Western blot, detect antibodies against Borrelia burgdorferi, the bacterium that causes Lyme disease. These tests are essential tools for identifying past or recent exposure to the Lyme bacteria and can provide supportive evidence of infection. However, they have limitations, including false positives and false negatives, especially in the early stages of the disease or in patients with immune system issues. As a result, the interpretation of test results should always be considered in the context of the patient's clinical presentation and history of possible tick exposure. Clinical diagnosis, on the other hand, relies on assessing the patient's symptoms, medical history, and physical examination findings. Lyme disease often presents with a range of nonspecific symptoms, including fever, fatigue, joint pain, and headache, making clinical diagnosis challenging. The presence of an erythema migrans EM rash, which occurs in some cases, can be a key indicator of Lyme disease. However, not all patients with Lyme disease develop the characteristic EM rash, leading to potential underdiagnosis. To optimize Lyme disease diagnosis, healthcare providers must integrate both Lyme Titer test results and clinical evaluation. A high index of suspicion for Lyme disease is crucial in regions where the disease is prevalent. In cases of equivocal or contradictory findings, further testing or reevaluation may be necessary. Additionally, prompt treatment may be initiated based on clinical suspicion, even if test results are inconclusive. Early diagnosis and treatment are vital to prevent the progression of Lyme disease and the development of more severe complications. Therefore, a comprehensive approach that combines Lyme Titer testing with careful clinical assessment is necessary for accurate diagnosis and appropriate management of Lyme disease. Lastly, what are alternative testing options for Lyme disease? Alternative testing options for Lyme disease include culture and molecular testing, such as polymerase chain reaction, PCR. While serologic testing remains the gold standard for diagnosing Lyme disease, culture and molecular testing may have a role in specific clinical scenarios. Culture of Borrelia species, the causative agents of Lyme disease, suffers from diminished sensitivity and increased turnaround time compared to serologic methods. However, it offers improved specificity, especially in patients with prior Lyme disease who may still have residual antibodies. On the other hand, molecular testing, particularly PCR, demonstrates high specificity in detecting Borrelia DNA. PCR can be performed on various clinical specimens, including skin biopsies, blood, synovial fluid, and cerebrospinal fluid, depending on the stage and manifestations of the disease. It can be especially useful in early-stage infections when the antibody response is not yet detectable. Alternative diagnostic modalities, such as antigen detection, lymphocyte activation tests, and nucleic acid amplification tests, may provide additional information, but should only be used in patients with a high pretest probability for Lyme disease, and by laboratories with expertise in this area. While these alternative testing options have their limitations and may not replace serologic testing, they can complement the diagnostic process and contribute to a more comprehensive understanding of the disease, potentially aiding in earlier diagnosis and appropriate treatment of Lyme disease. With that, we have come to the end of this video. If you appreciate what we do on this channel, kindly like the video and subscribe. It's completely free and takes less than 2 seconds. Thanks for watching.